In my previous video, part 1, I have covered the mythology of Bhujangasana. And in this video of part 2, we will talk about benefits, contraindications, the do's and don'ts of Bhujangasana. Friends, Bhujangasana is actually a back bending posture. It is said to be one of the most energetic and exhilarating member of the yoga asana group. Many individuals have the anatomy of the upper back as rounded and the chest area closed, also known as upper cross syndrome. Now that I have already covered in my yoga anatomy course of the yoga for the musculoskeletal system. The problem of present day lifestyle job and work culture, where a person often due to prolonged hours of sitting along with slouching posture at the desk is at a high risk of developing musculoskeletal injuries. Poor postural positions restricts the front of the chest and exaggerating the effects by means of shallow breathing. Ultimately, that has a negative impact on the general well-being of a person that also culminates into a reduced work performance on account of exhaustion, energy levels. Thus, adding Bhujangasana once practiced allows and favors the thoracic cage to expand, beside enhancing flexibility of the vertebral column. Now friends, all these practices helps you to develop the strength of the lower back. This is a great asana for people who tend to slouch. Although there are plenty of claims about Bhujangasana, some of the scientific supported benefits of Bhujangasana are stronger erector spinae muscle, that is extensors of the back, the muscles of the back that make you stand, the erector spinae. In fact, erector spinae is a group of muscles, that is iliocostalis, longissimus and spinalis. It strengthens the bicep and tricep, strengthens the deep core muscle. Cobra pose is basically stretches your psoas group, the pectoralis major, minor and the rectus abdominis. Other benefits of Cobra pose, it increases the flexibility in your spine, encourages deep breathing through chest expansion, help corrects rounded shoulder when you perform with proper alignment. Try to externally rotate the shoulder socket joint. It can also help you elevate sciatica because of the balancing of the pelvis. But almost anything that you elevate, it also increase your pain. So just be careful. It helps improve posture as the muscle needs to extend the spine in Bhujangasana also helps you to stand straight. This pose also increases your metabolic rate, thereby results in decreasing blood glucose, cholesterol, nitrogen in urine and increase in blood protein. This helps in conditions like diabetes and cardiovascular disease. It also helps to improve your digestion. It drives stress and anxiety away, provides relaxation and rest for the mind and body. It also helps in insomnia and high blood pressure. It is said it also activates your kundalini, it activates Muladhara, Anahata, Vishuddhi chakra. The pose tones up the adrenal and thyroid glands and it improves their function. The pose burns the extra belly fat, hence it helps you in weight management. Now let's talk about the contraindications. Now Bhujangasana should not be practiced by those with carpal tunnel syndrome or any injury to the back, arms or shoulders. Additionally, it should be avoided in case of recent abdominal surgery. Normally, Cobra pose does not involve any risk. However, Those who are having lower back pain or spine injury or disorder should consult their physician or the physiotherapist. Although Cobra pose talks about relieving the back pain, but just be careful. There are many times people doing Cobra pose increase their back pain, so just be careful. One should avoid this pose immediately after a meal, that is definitely understood. During pregnancy and periods, one should avoid this posture. People who have condition like hernia or who have undergone surgery should avoid that. So let's talk about some salient points to remember, that is the do's and don'ts. All the exercises should be done very smoothly, moving the chest vertebrae by vertebrae. Use the back muscles, not the arms, to raise the head and trunk. Try to do the asana slowly, steady and different posture, slowly and instead of directly jumping to Bhujangasana. Now let's talk about the don'ts. Do not jerk the body while you're lifting the chest up or while coming down. So friends, I think we have covered the benefits, the contraindication, the do's and don'ts. In the next video, we will talk about how to do Bhujangasana and the variations of Bhujangasana. And later on, we'll talk about the anatomy of Bhujangasana. Till then, take care, keep smiling. Namaste.